we have this dream of Valhalla on digital, but I'm just curious how we're going to now parse all that out and extract the value. So on digital, from your perspective and Innovis's perspective, what do you look at?
Yeah, I think before I come back and I'll answer that, I'm actually going to put something in that makes it even harder to think about how we capture that and where do we store it and all those things. And that's this piece, which is Nadine and Proximy are primarily at the moment solving things in the theatre, so intraoperatively. And we were talking about this yesterday, weren't we, which is actually when we think about digitalisation of surgery, it's not just the piece that's in theatre, it's that pre-operative piece, which is primarily where we sit as Innovis. So we're able to capture lots and lots of data on how well surgeons are performing in a simulated surgical environment. And then there's the post-operative piece as well, and there's all that data sitting in the pre and the post-operative world. So it comes back to your question, which is, well, actually, if we are capturing all that data, what are we going to do with that so that it has value to the patients? Because that's the whole point of what we're doing here. And I think one of the most important things is we're looking at building systems and technology that has interoperability. Because there's no point in having siloed data from the Innovis platforms, completely siloed from the Proximy platforms, siloed from the Avail platforms. That's not going to make any sense. It doesn't help anyone. We need huge amounts of data to come together. Then over to your question, how do we store that? I honestly don't know the answer to that yet. It's going to be a major undertaking, but I think really the first step is getting these platform providers speaking to each other and making sure that technology is built in a way that it can work together.